So here's the endoscopic image of the mass. Here's another view of the mass. You can see that the surface appears eroded. An endoscopic ultrasound image, and the mass appears to be extending into the pancreas. And in addition to a forceps biopsy, we also received an FNA that I'm not going to be showing you today. All right, so this was a mass from the periampullary region. And here's the ampullary tissue, or mostly duodenal tissue here. And I will confess to you right off the bat that I'm hiding something from you, and it's your job to figure out what I'm hiding. Here's the lesion under consideration. It is very vascular, but I will ask you, and this is the only hint I'm going to give you, I'm going to ask you to look at the cells between those endothelial cells as well. Obviously, this may or may not be helpful, but this is the very best I'm going to be able to give you without giving away the answer. So keep staring, lots of vessels. There are certainly cells between the vessels. And I guess that's pretty much it. That's exactly what the biopsy showed. And I can promise you that I was taken aback by what I saw on the immunohistochemistry. So more to come. So the stain is a Pax8 stain, and the patient had a history of renal cell carcinoma. And there are clusters of cells here. The vessels aren't particularly prominent, but they are clearly clusters of cells. Some of these cells are actually lining up in a row, oddly enough. But let's go back to the H&E and see if we can identify them. All right, so in retrospect, perhaps these are the neoplastic cells that are being highlighted by the Pax8 stain. But oh boy, even in retrospect, I'm having a very hard time identifying these neoplastic cells. It's probably these cells here, perhaps these cells here, but I promise you that this case did not leave me with a warm, fuzzy feeling. I showed it to our GU pathologist, who agreed with this diagnosis. Certainly did help. So what message did I learn from this case? One, of course, is that age-old message. If you don't dig through the history, you will occasionally go down the tubes and make one of those terrible errors that you would prefer to forget. You're distracted by all of this vascularity, and you might even consider a vascular neoplasm instead of a diagnosis of metastatic renal cell carcinoma. So metastatic renal cell carcinoma to the periampullary region.